I'm at the University of California at San Diego, where a few months ago there were 40,000 students here. You could barely move about, you couldn't find a place to park. Right now, this place is a ghost town. The reason is the novel coronavirus. Almost all instruction has been shifted online as everybody tries to figure out the best way to treat people with the disease and how to prevent it. UC San Diego has proven to be a major player in this whole thing, particularly when it comes to developing therapeutic drugs and the hunt for a vaccine. We spent time talking to Dr. Davey Smith, who is head of infectious diseases here. He told us about efforts to develop therapeutic drugs, but he also took a lot of time to tell us where everybody is in the race for a vaccine.
We're really behind. So we're about 6 months into this virus being used to infecting humans and for causing disease in people. And scientists haven't quite understand all the nuances that have occurred with that. How does it cause illness in some people and not in other people? How do people stay asymptomatic but able to spread it to a whole bunch of other people, while some people don't have a lot of virus but still get very sick and in the hospital and even pass away? Our immune responses wane. So once we get one coronavirus, let's say in the fall, we can get it again the next fall, just because our immune system sort of forgets about what it looked like the last time. It is possible that we could get vaccinated for once, and then after a while it would wear off. So you could think that the first time that we get a vaccine, it might last a couple of months, and then our immune system gets used to it and was able to protect from exposure. But then that immune system response sort of wears off after time, and we might need a booster.
I'm in the laboratory of Dr. Davey Smith. He's head of infectious diseases here at the university. He and other people work on many things. The university is particularly involved in trying to develop therapeutic drugs to treat COVID-19. They're also looking at how the disease spreads and what its composition is so that drugs can be developed against it. What they're also doing here at UC San Diego is trying to develop vaccines so they can prevent it from ever happening. The big worry is right now that they have to slow the global and national spread of the novel coronavirus. And the best way to do that ultimately is to have a vaccine that works on everybody, from small children to the middle-aged to the elderly.
The advantages of having basically almost all the scientists in the world focused on this effort is we have all the best minds going after trying to fix this problem. The bad part about that is we have all these people going after to trying to figure it out. And today, I get tons of papers, and some of them haven't been reviewed yet, and scientists have all these different opinions, and they're good, but it needs some time to sort it out. So running at this very quick pace, it's hard sometimes for science.
So as you know, there are a lot of tests for the novel coronavirus, and they're trying to improve the tests, and companies are trying to come out with better ways to test their employees. When we arrived here today, we were tested, myself and Alejandro Tamayo, the photojournalist on this story. What they did was they took a swab in our throat, which made me kind of gag, and we took one, the thing that you keep seeing going in people's noses. It didn't go as far as the other ones did, but it went far enough. It kind of really tickled. The other one made you gag a little bit. What is interesting about this particular test is the speed. So I've been hearing that most of these tests take an hour or more, but this one is going to be taking about 30 minutes. And actually, as we're standing here, we're waiting for the results. I got to tell you, I'm a little bit nervous about that.
I have a great sense that the public has a hard time figuring out what's going on, because I also have a hard time figuring out what's going on. And it's something that I'm doing 10, 12 hours a day, is just going through the literature as much as I can, generating my own data, and still stuck. Where we are in testing is a very good question, and at the moment there's so many different people trying to solve that problem, which is a good thing. Having lots and lots of different platforms and machines to run all these tests is exactly what's needed. But the next step is to figure out which ones are the best ones, which ones are the ones that are most cost effective, which ones are the ones that we're going to need to screen someone who maybe is asymptomatic, or versus screen someone who might have had an exposure. All those need to be still clarified. So we're at that moment of the process in our testing.
So when we arrived here today, Alejandro and I both got tested for COVID-19. It made me pretty nervous. I didn't know what they were going to actually say, and we both turned out to be negative, thank God for that. And it really didn't hurt in any way. It's kind of odd to have that device in your nose, and we had something in our throat today because they were doing some testing. What I would say to you is, get tested. It's out there. In a lot of places it doesn't cost hardly anything at all. In many places it's free. We got a really clear message from Dr. Davey Smith here today, and that message is this. Scientists are making good progress on therapeutic drugs. The drugs are going to become more available in treating people who have symptoms of the disease. But the bad news is that they're not close on a vaccine, not here, not anywhere in the world. That could take at least another year to get out there, and then they have to produce it, and they really have to widely distribute it. So protect yourself, because there might be drugs to help keep you alive, but there's not going to be a vaccine anytime soon to prevent you from getting this disease. Reporting from UC San Diego, this is Gary Robbins.